watching KOAT Action 7 News.
A new action is underway to improve mental health care in rural New Mexico. Providers tell reporter Julian Paras the problem is even bigger than people realize.
We have a very vulnerable population, and the needs are tremendous.
A lack of reliable mental health care is a problem some providers say is so serious they're worried to talk about it openly. One provider, speaking anonymously, says areas like the Navajo Nation are in dire need of help.
I think that would really alleviate, but I think there are so many issues out in tribal areas that are often overlooked.
He wanted to remain anonymous, but serves as a tribal health advocate and community organizer who specializes in Newcomb, New Mexico, and the northwest region of the state. But the director of UNM's Rural Residency Program says help is on the way.
And when they go out there, they provide mental health care to those communities in need.
Dr. Jose Kanaka says the vast rural population in the state does not have the best access to behavioral health care. It's why he says a program like this is crucial for people who live in areas like Alamogordo, Zuni Pueblo, and even Las Cruces.
Maybe some of the patients from those communities had to travel to the big cities to see a provider.
More than half of New Mexico's population identifies as Hispanic or Latino, and 10% as Native American. These are groups Kanaka and this provider agree need more support.
Probably one of the biggest barriers is being able to retain providers in the area, and also to provide them with the resources to be able to carry out services effectively.
In rural areas, he says people are dealing with substance abuse and traveling long distances to a reliable provider. Kanaka believes as time goes on, this program will continue to fill gaps and address the growing need for accessible mental care.
I became a doctor to serve people, to serve those communities.
For KOAT Action 7 News, I'm Julian Paras reporting.